Good afternoon, and thank you for joining the RLS Foundation's webinar titled RLS Advocacy Preparing for Hill Day 2024. My name is Adriana Colucci, and I'm the Communications Coordinator at the RLS Foundation. The RLS Foundation is using Zoom webinars for all webinar events. To ensure seamless webinar access, confirm that your Zoom app is up to date with the current software. If you need help accessing the live webinar on your computer, call the phone number listed on your registration confirmation email for assistance. If you have any other questions, please email kaleigh@rls.org, KALEIGH@rls.org. Before we begin, please be aware that all attendees will remain on mute during this hour. We thank you for the questions submitted with your registration. The presenter will answer as many questions as time allows following the presentation. After the webinar, the recording will be available in our website's member portal section on the next business day. If you are not a Foundation member and would like to view this and other recorded webinars, we invite you to become a member today by going to www.rls.org. As always, individuals suspecting they may have RLS should consult a qualified healthcare provider. The information offered in this webinar is for informational purposes and should not be considered as a substitution for the advice of a healthcare provider. All content, including without limitation, slides, handouts, videos, and other materials are the property of their respective creators and as such are protected by copyright. They may not be reproduced, distributed, or otherwise used in any fashion without the permission of the creator. Our speaker today is Phil Goglas II, a managing partner at the Health and Medicine Council, the RLS Foundation's Washington representative. Phil has worked with the RLS Foundation for several years, during which he has helped the Foundation make an important impact in the context of public policy, particularly helping facilitate the annual Hill Day event. He will be joined by Josh Fine, who is also a Washington representative. Thank you, Phil, for sharing your time and expertise with us today. I now invite you to begin your presentation.
Thank you, Adriana, and it's great to be here with everybody today. For those of you who I've met before, good to be with you again. For those of you who may be advocating for the first time, thank you for using your voice on behalf of the entire RLS community. So we'll go to the next slide. So again, I can't say thank you enough for those of you who have come to DC before or have participated in advocacy. You have definitely heard me say thank you probably a million times because it is so critically important to thank all of you as advocates for the community for your participation, because I know that sharing your personal story is a very big deal, and sometimes it's not always easy for everybody to do. By sharing your story and by participating in our advocacy efforts, you're helping your legislators and elected officials better understand restless leg syndrome, and you're giving a voice for the entire community, those who may not be able to travel to DC or wish they could participate but are unfortunately unable to. So just by you participating and sharing your voice really does make a difference. So today we're just going to go over how Congress works. We're going to review how to have a congressional meeting. We'll review our legislative issues, and then we'll take some questions at the end. So a quick, review to Schoolhouse Rock for those of you who may remember that from back in the day. I know I do. But the three branches of government that we work with are the executive branch, which is the administration. They are the ones who enforce the law. That is the president. You have the judicial branch, which are the courts. They are the ones who interpret the laws. They're supposed to be the umpires calling balls and strikes. And then you have the legislative branch, which is Congress, and they're the ones who create and enact laws and specific policies, which is why we work very closely with them. So, of course, Congress has broad authority, and one of their main pieces of authority is having the power of the purse. Each year, Congress has to decide how much each federal agency is funded at, as well as what recommendations they should have. Congress also creates specific policies that are implemented into law, whether it's with any specific access issue or a specific policy. And of course, they have oversight over federal agencies to make sure that the individuals who are leading a federal agency or part of the federal government are responsive to what Congress Congress wants them to do, which happens by you, the people, influencing Congress and what you want your members to support and to follow. So first, we'll talk about Congress. It's broken up into two different sides. When you hear somebody talk about Congress, they are talking about both the House and the Senate. We'll start with the Senate. Each senator is elected to a 6-year term. You have 2 senators from each state, so it doesn't matter if you live in a high population state like California or Texas, or a low population state like Delaware or Rhode Island or one of the Dakotas. You have 2 senators regardless of population. And the Senate is elected to 6-year terms, but those terms are staggered. So you only have 1/3 of the Senate up for election at a time. So of course, this year it's an election year. Only about 33 members of the Senate are up for election at this point this year. Next, we have the House of Representatives, which each member is elected to a 2-year term, and you have 1 representative from each district. This is where population matters. You will always have 435 representatives of the House of Representatives, but what fluctuates every 10 years is the amount of members that each state sends to Washington based off of population. So again, if you live in a high population state like Texas or California, you have a lot more members of the House than North Dakota or South Dakota, which each only have 1 representative here in Washington. For many years, Montana, as a state, only had 1 representative for the entire state. But as a result of the last census, they actually gained a new seat and now have 2 members of the House of Representatives. Where the House differs from the Senate also is each member is up every 2 years. So it doesn't matter when they were first elected. Every 2 years, the House of Representatives has to run for election. So in November of this year, all 435 seats are on the ballot. And this is why they often call the House of Representatives the People's House, because it directly is responsive to the will of the people, whereas the Senate, being a little bit more staggered, is a little bit removed from sort of the day-to-day temperature of the population. Next, just want to go over some key committees that we work with. On the Senate side, there's the Appropriations Committee. As we mentioned, Congress has the power of the purse. So the Senate Appropriations Committee decides how much each federal agency receives in funding on an annual basis, but also provides specific recommendations for how they want to see that money funded, or how they want to see that money spent on an annual basis as well. We also have the Health, Education, Labor, and Pensions Committee, which is appropriately the HELP Committee, and they are primary jurisdiction over healthcare issues. They're very important to us because that's where a lot of opioid policy is discussed, as well as different access issues that are being talked about on Capitol Hill, the different bills that come up, and where other policies are proposed and move forward. You then have the Finance Committee, which oversees Medicare and Medicaid policy. It's also it is the chief tax writing committee on the Senate side. So the Health and Finance Committee work very much hand in hand when it comes to any number of healthcare issues, which is why we focus on working with them on the Senate side. Similar on the House side, you have the Appropriations Committee. Again, they decide how much each federal agency receives in funding, how they want to see that funding being spent, and other key recommendations that they support. You have the Energy and Commerce Committee, which is a complement to the Health Committee on the House side. Again, that's a committee of jurisdiction when it comes to key healthcare policies and other proposals. And then you have the Ways and Means Committee, which is the complement to the Finance Committee. Ways and Means on the House side oversees Medicare, Medicaid, as well as being the chief tax writing committee in the House. So again, Ways and Means and Energy and Commerce work very closely together, the same way Health and Finance do on the Senate side. So some key federal healthcare agencies that we work with, in case you haven't been able to tell by now, DC is full of different kind of acronyms. So don't worry if you're trying to remember all of them or jot them down. All of this information is just good background for you to have. But we very much focus on the work of the National Institutes of Health and the NIH. They are the premier research organization here in the United States by the federal government. There are a lot of good basic science opportunities that NIH funds, and there's a lot of good work that they do with stakeholder organizations like the RLSF. We're very fortunate to have a very good working relationship with different institutes at NIH, that oversee RLS research funding, as well as collaborative efforts to increase our understanding of RLS. You then have the Food and Drug Administration, the FDA. They are the ones who approve drugs. They check on their efficacy. They determine what they can be approved for, what uses they're for. It's very important that they work hand in hand with stakeholder organizations as well to really understand what the needs are of the patient community. You have the Centers for Medicare and Medicaid Services, which is CMS. They're the ones who oversee, of course, the Medicare and Medicaid policies and programs. But what's also critically important is private insurance often will take a look at what CMS is covering and will often follow suit. You then have the Centers for Disease Control and Prevention, which is the CDC. Now, this is one of those organizations that, 7 years ago, if we would have asked 100 people on the street, do you know what the CDC is? They probably would have said, no idea. But of course, because of COVID and the CDC guidelines of 6 feet, 7 feet, whatever, how many times to wash your hands, mask, no mask, a lot of people know what the CDC is now. So the CDC is the public health agency that works with the public. The NIH does a lot of basic science research, but they're not in the business of sharing those in public health campaigns or bringing that information to the ground. That's the work of CDC. And what we do as a foundation is work very closely with all of these federal agencies to make sure that they have the RLS patient in mind when they make decisions, as well as when they are discussing different ways to advance key things that are important for us and our community. So why does all of this matter, and why are we all here today? It's most important for you to work with this critical mass of support that we have with people all across the country that are using their voices to help advocate for research, increase research funding, improve overall health and healthcare. Because when all of us work together with one voice, we influence all of our legislators. It doesn't matter if you're down in Florida, in the state of Washington, New York, or Arizona. When we have this nationwide grassroots network of advocates, we really are making that difference because we are elevating the understanding of RLS across the country and among key decision makers. So this is why your voice truly is most important when we talk about advocacy. So a lot of people will ask, how do I create my story? What should I focus on? Our best recommendation is to make your story personal. You are the biggest expert in what your experience has been. Keep it simple and concise. You don't want to be in a situation where you're talking for 20 minutes, but you don't want to be in a situation where you're just talking for 30 seconds either. So think about, what has your experience been? What has your journey been? What challenges have you faced? Whether it's as a patient, a caregiver, a loved one, what have you experienced with RLS that you want a decision maker to know about? And what do you want to leave them with to help them understand why it's important to raise funding for research to support all of our other legislative priorities that we have? Your personal story really does make that difference. So how do you prepare? I know that there is a lot of information for folks who may be advocating for the first time, and you're trying to say, how am I going to remember all this? We want you to read the materials that you receive via email, make a note of any questions that you have. When you prepare your RLS story, again, make it personal. How has RLS affected you as a patient? If you're a loved one or a caregiver, what has your experience been? Write it down. It always helps to practice it. And we always encourage people to keep it to about 3 or 4 minutes, so that way you're able to fully encompass what you want to share without going overboard or oversharing in a meeting, because meetings aren't a long period of time. They're about 20 to 25 minutes. Of course, practice. Say it out loud as many times to help with your nerves. For those of you who have never advocated before, you may feel intimidated coming to Washington and sitting across from a staffer and wanting to make sure that you're comfortable with what you're saying, especially when we talk about different time and things like that. And again, be confident. You are the first and foremost expert in your story and what your experiences have been and what your journey is. I am an expert in policy, but I'm not an expert in what your story is or what you have experienced. That's where you are the expert, and we want you to make sure that you feel comfortable and confident in sharing that with decision makers. So some key items during your meeting: you want to thank the staffer for meeting with you. You want to talk with the staffer about RLS and how it has affected you. You want to share with them the work that the Restless Leg Syndrome Foundation does. Remind the staffer that you are a constituent and part of the RLS community. Introduce the legislative asks. Ask the staffer if they have any questions or different things that they want to discuss. And then you thank the staffer again for their time. I just want to let everybody know, of course, knowing what our issues are is critically important, but you don't have to memorize everything. We're going to be talking about specific funding lines and other key priorities, but we don't expect you to memorize every single detail. It's important for you to know and understand why we're advocating for these, but you will have somebody with you who is a team captain who can take the lead in making sure to cover the legislative issues. Also, the staffers will have received all of our materials ahead of time. So don't feel like if you're having a very good conversation and the staffer is very much engaged and they're asking a lot of good questions and you're looking at your watch and say, well, we only have 30 seconds. Don't feel like you have to cut that conversation short or rush through our legislative asks. They will have all of that. The most important thing is giving you that opportunity to engage with that staffer and to really, again, use your voice to raise awareness. Following your meetings with the House and the Senate, send us feedback. How did the conversation go? If there was a question that the staffer asked that you don't know the answer to, it's perfectly okay to say, I'm not sure, but we will get that answer and follow up with you. Is there anything that the staffer mentioned that is relevant? There have been times where we've met with staffers and they said, oh, my uncle has RLS, or my cousin has RLS, or my brother or sister, or even I have RLS. Is there something that has come up in the meeting that we should know? And who did you speak with as part of that meeting? All of that really does help us continue our advocacy work year round in engaging with all of these offices. So now that we've gotten the background of why we engage, why we advocate, how we do that, I just want to give a very brief Washington update of where we are. This is the second session of the 118th Congress. They are focused on the annual budget and appropriations activity. And of course, we have continued congressional focus on healthcare policy. It's no secret that this is an election year, so there is a lot going on. Right before Congress left for the August recess, which we're currently in, they were working on appropriation bills to fund federal agencies. They're going to come back into session in September. And what they're going to do is they're going to pass a short-term continuing resolution, which keeps the government funded. It's not clear how long that CR, that continuing resolution, will go to, but a lot will get itself worked out, after the November election, when we know who's going to be in the majority of the House, who's going to be in the majority of the Senate, and what the next administration will look like. And of course, it's continued work on our end to make sure that all of our funding priorities are elevated, as well as our key access issues or key healthcare policy issues are focused on as well. So we'll get into that next. So our legislative issue review. First and foremost, medical research is critically important, so we're going to talk about that. Appropriate patient access is, of course, very important to our community, as well as raising education and awareness among decision makers. So first, again, I know that there are a lot of numbers here, acronyms and all of that. This is all good background to have, but I want to stress again, you don't have to memorize all of these things. There will be plenty of materials for you to reference. Staffers are very familiar with a lot of this as well, but we like to talk about the importance of it so you have that background. As I mentioned, the National Institutes of Health is a critical research hub for RLS, and research on RLS is funded across many different NIH institutes, including the National Institute of Neurological Disorders and Stroke, National Heart, Lung, and Blood Institute, National Institute on Drug Abuse, and National Institute of Mental Health. So what we're asking for is for the overall NIH to be funded at least $51.3 billion in the next fiscal year. That will also ensure that all of these institutes receive increases in their funding as well. We are very fortunate to, as I mentioned before, have good working relationships with the NIH, have met with the leadership of NINDS in the past, have met with the leadership of NHLBI, have met with the leadership of NIDA. to really speak about the important work that they're doing, excuse me, and the work that they can focus on moving forward to ensure that we do have that quality research to help us better understand RLS. In addition to the important research that's done at the National Institutes of Health, the Department of Defense has a peer-reviewed medical research program that lists specific conditions as eligible for study, which allows researchers to be able to compete for grants, to receive funding, to be able to focus on research. So we're very fortunate that sleep disorders and restriction, which RLS would fall under, has been listed as eligible for study in the fiscal year 2025 list. We want to make sure that as they finalize the appropriations for 2025, that remains in there, because it's critically important for our research community to be able to apply for funding. And we've been very successful in the past with folks doing that as well. So of course, appropriate patient access is critically important. We work very hard as a foundation to advocate and educate with decision makers on Capitol Hill about understanding the important need for patient access, understanding that RLS is not a chronic pain condition, that our patients who utilize that low total daily dose of opioids to manage their RLS, it's to manage and treat that underlying neurological condition. So we work very hard because there is a lot of I would say a misunderstanding and a belief that, oh, RLS is just a pain condition. It's not. So we work very hard to ensure that decision makers understand that when we talk about access to opioids for management of RLS, we're not talking about individuals who are drug seekers. We're not talking about individuals who are misusing or abusing these. We're talking about patients who have successfully utilized this medication for years. And we want to make sure that the government doesn't get in between them and their doctor, or we don't see pharmacies not filling prescriptions, doctors not prescribing these life-sustaining medications. We just want to make sure that our patient community doesn't have any barriers to access these. So it's always important to share this with decision makers, because oftentimes having that personal connection to it and sharing that experience really does help them see things in a different light and understand why it's important to maintain this critical patient access for the community. Now, when we talk about education and awareness, of course, it's critically important to educate not only the medical community, but also the general population as well. So there's a program at the Centers for Disease Control and Prevention that is a national neurological condition surveillance system. We want that to be funded at $5 million, again, in fiscal year 2025. And what that does is it really serves as a good resource to collect and synthesize data out there to better help us understand neurological disorders, which RLS is, and we need to make sure that there are opportunities to have more research being done to raise that awareness, to educate the medical community. There are often times where I know with patients, you may be more of an expert in your condition than the doctor, and they're the ones who you turn to for medical advice or how to be treated, but you oftentimes may have to educate them about RLS. So we just want to make sure that this program continues to receive that $5 million in funding. And our next education and awareness program is the Chronic Disease Education and Awareness Program, also at CDC. Why this program is critically important is because there used to be that National Healthy Sleep Awareness Project that was very active in public health activities on sleep and sleep disorders that affect, as we always talk about, every body system and has an effect on many chronic diseases. Unfortunately, the CDC was no longer supporting that program, so the RLSF has been part of the larger patient community in advocating for this key program. And when we started with advocating for this program, the first time it was created, it was funded at $1.5 million. The Senate just proposed funding it at $6.5 million. So a pretty substantial increase from the 1.5 to where we are now at 4.5, but then a $2 million increase that the Senate proposed for this program. This helps organizations like the RLSF compete for grants to focus on raising awareness and, again, educating the medical community or other individuals about what RLS is, are there key research areas that have been utilized? Are there new discoveries through research that folks should know about? And this program really is critical for us to be able to work across the country to be able to increase education and awareness all around. And I know that that was a lot that I went over. I know, Adriana, we have some questions, so I will stop there so that way we can hit on any questions that have come in.
Yes, and thank you so much for giving us a little bit of insight into our legislative priorities and into the congressional processes that are in place. I do want to start by going over some event logistics. Hill Day will take place on Monday, September 9th. And our large group of participants are broken down into smaller groups that will consist of a foundation staff member, a board member, an RLS physician expert, and 2 to 3 RLS community members. How are these individual meetings with legislative representatives typically structured? And how long do they last?
So they're structured by the state you live in. So we'll be reaching out to your individual House member and your 2 senators to arrange a meeting with them. You'll be most likely meeting with one of their staff members. You'll go to their office on Capitol Hill and you'll sit with one of their staffers. Meetings are generally 30 minutes, but we try to encourage everybody to keep them to about 20 minutes. So that way you're able to get to your next appointment and be able to ensure you cover all that you need to. But you'll be, as Adriana mentioned, teamed up with experts. So again, the most important thing for you to do is to share your story. You'll receive a copy of your schedule, which will give you detailed information about who you're going to be meeting with, who they work for, and any other relevant information. Josh, I will turn it over to you in case there's anything I forgot on that response.
No, I think that, I mean, yeah, you covered, all the basics.
Meet with during our legislative meetings.
No, sorry, I didn't hear. I think it cut out.
Oh, sorry, I'll repeat it. Who do we meet with during these legislative meetings?
Thanks. So, yeah, these meetings are not going to be with, the actual senators, the actual representatives. Now, it is possible that, they could be, in and out of the office, or you could see them in the hallway. So, could be possible to meet them, maybe take a picture. But these meetings that we schedule are with the legislative staff. So we typically aim for a meeting with the health, legislative aide. So this is one staff member, or sometimes there's multiple staff members within a congressional office who covers healthcare, health policy. So most likely, these staffers are going to have some knowledge and background about, the healthcare system in general, health policy, things going on in DC, but they may not be as aware of, specific conditions, including RLS. So that's why, it's always very important to, just explain about the organization and to explain about RLS so that they have the backgrounds. But, many of the federal, agencies, programs, bills we might be talking about, they should have some familiarity with it.
How many offices do we typically meet with?
Yeah, so this depends. We generally aim for around 3 or 4 meetings in the morning and 3 or 4 meetings afternoon. The meetings will be scheduled for, 30 minutes. So we might have 10, 10:30, 11, 11:30, then a break for lunch. Maybe an hour, hour and a half of a stoppage, and then in the afternoon, 1:30 to 2:33. So probably around 7 to 8 total for the day. And this will also be split up by chamber as well. So typically what we would do is we would start with the Senate in the morning. So we would go around to the different Senate offices, which is on one side of the Capitol. And then during that lunch break, would walk about 15 minutes, across the Capitol over to the other side where the House office buildings are, and then do meetings with, House representative offices in the afternoon. So that's typically how the day usually works for advocacy days, but it can also just depend on, kind of individual, schedules and, team needs.
And I'll just say there's plenty of time to get to your meetings, and you will have all of this information as well. We do aim to give you one meeting with your House member and two with each of your senators. Sometimes that's able to happen. Sometimes you may only get your House member and one of your senators, but more information will be on that schedule you will receive ahead of Hill Day. And you, again, will be with pros at this who will make sure you get to where you need to at any point. If you do have any issues with mobility, or are there any other health issues that you have, please do let the foundation know so that way we can take that into account as well.
If I'm attending Hill Day, where do we meet on the morning of?
Yeah, so the plan will be to meet at the HMC office. So our office is located, and of course, we'll provide the specific address, but our office is located in about a 10-minute walk from the Senate buildings, around 15 minutes from the Capitol, 25 minutes from the House of Representative office buildings. So we'll meet there in the morning, probably around 8:30 to 9 a.m., depending on when the first team meetings are. Usually we aim for starting around 9:30 or 10. And from our office, we can either, do a short walk over to the Senate buildings, or take an Uber, taxi, 5-minute drive. But yeah, the plan will be to meet at the HMC office. So that would be meeting with me, most likely Phil, my other colleague, Matt, and then we can all coordinate from there and head over.
How much walking is required during Hill Day?
Yeah, so it's going to be around probably 30 minutes of walking outside. But as I said before, taxi, Uber, is an option. But at a minimum, it's going to be just walking around, the Senate office buildings, or walking around the House of Representative office buildings. So maybe around overall 20 to 30 minutes inside, and then around 20 to 30 minutes outside. But the outside part can be, limited by, taking Ubers and taxis if needed, especially if it's, a very hot day. We don't want anyone getting dehydrated, and it can, be quite exhausting going, from meeting to meeting. So, very aware of that. But yeah, probably not more than an hour maximum.
And as Phil mentioned, if you have any mobility issues, just let us know so we can adjust your schedule accordingly. Moving into preparing for Hill Day, as Phil mentioned, your story should be limited to 3 to 4 minutes. Do you have any tips for how someone can shorten their RLS, which can sometimes be a lifelong journey, just into 3 to 5 minutes? What parts of their story should they prioritize?
Yeah, I would say that the main thing to prioritize would be, stressing how it's impacting your family, your community, trying to make the story as, local, as possible, because ultimately what these, offices care about, of course they care about, the welfare of, every American, but, they want to hear about how it's affecting, their constituents. They want to know about access to healthcare, access to medication, within specific, regions. So, you're from Illinois, the senators from Illinois are going to want to know about, the status of, access to care in the Chicago area or greater, Chicago area, wherever you're from. So they want to know how, it's affected people in your community, how, how easy it has been, for you, maybe compared to other people within the RLS community. So I think just stressing how local, the impact of RLS is on you, would be my biggest piece of advice.
Okay. What are some of the past advocacy successes from the foundation's previous Hill Days or advocacy efforts?
So Josh, I'll take this one first, and I'll just say that we've been successful in, again, seeing that chronic disease education and awareness program first be created. It wasn't around pre-fiscal year 2021. So because of the foundation's efforts, that program was created. That program has received meaningful increases over the years, which is a result of our education efforts. We've also seen increases to NIH's budget, as well as continued inclusion of sleep disorders and restriction, which we can specifically point to the work of the foundation. There have also been over the years some key recommendations in appropriation bills that specifically mention RLS that we can attribute to the work of our advocates as well.
Excellent. Okay, well, thank you so much, Josh and Phil, for spending your evening with us. For everyone listening, if you haven't registered for Hill Day yet, the last day to register is this Friday, August 23rd. That gives us enough time to schedule meetings with your representatives accordingly. If you have any questions, or if you're interested in attending this year's Hill Day, happening on Monday, September 9th, you can register online at www.rls.org/Hillday. You can also contact info@rls.org, info@rls.org, and we can send you our prep packet, which will review all the information presented in this slide and go through some of the details and agenda for Hill Day. Other than that, to learn more about upcoming webinars and events, please visit our website at rls.org and click on the Get Involved tab, then click Education and Events. Thank you so much, Phil and Josh.
Thank you, Adriana. Thank you, everybody.
Thank you.